Maria, it's good to see you. It seems like now that we're kind of getting back, hey Kevin, seems like now that we're getting back to kind of the normal flow of things, we're not seeing as many on some of our broadcasts. So that's both good and bad. Really happy to have you guys joining us this morning or this afternoon. It is afternoon now, at least Central Time. I think we've got everyone settled in. We may have a few joining us as we continue, but I know we've lifted the waiting room so that folks can join a little late if they arrive. I want to just say again, welcome. Hey Ben, good to see you. I just want to say welcome to everyone here for our ESAS, which is Essential Substance Abuse Skills webinar today. My name is Steve Steiny. I'm one of the managers here at our American Indian Alaska Native Addiction Technology Transfer Center. We have Avis Garcia with us, who will be our speaker today. And today's topic is professional readiness. So before we get going with Dr. Garcia and turn the floor over to her, I just have a few slides I want to go with all of you, go through all of you with, and then we'll get started with today's presentation. So again, great to have you all here. Settle in and enjoy the next 90 minutes, where what we're hoping to do is save a little time at the end to have some Q&A and maybe some discussion regarding this particular topic. So great to have you here. I also have Ella Driscoll and Abby Buffalo here assisting just with some of the technical issues. So if you are having an issue, technical issue, just throw us a message in the chat box and we can try and address that. So hopefully that won't be a problem, but we have Ella and Abby here to assist. So as most of you know by now, this event is brought to you by the National American Indian Alaska Native Addiction Technology Transfer Center. We are located at the University of Iowa in the College of Public Health here on campus in Iowa City, Iowa. We are part of a larger national ATTC network consisting of 10 regional centers and another national coordinating center. This project is funded and supported by SAMHSA, and the content is developed by the presenter, and the opinions expressed today do not necessarily reflect the views or policies of SAMHSA, HHS, or the American Indian Alaska Native ATTC. Again, as many of you know, we will have a follow-up to today's event where we will send out an email which will include links to the presentation slides. And we are recording this event, so if you have a colleague or a coworker that's not able to join us, we will have a link, and this recorded presentation will be available on our YouTube archive for our center. So that's something that you can forward on to a friend or colleague if they weren't able to attend today. And we also will offer 1.5 CEUs for today's presentation. If you're interested in that, you would just request CEUs with our communications team, and we will arrange to have those certification documents sent to you via email. Is that accurate, Ella? Am I following the protocol on that?
Yes, if you see our follow-up emails, you will have instructions on how to request and receive CEUs.
Yes, thank you. And we also have, we will ask you to complete just a short survey We'll post that in the chat box today, and you can complete that at the conclusion of today's event. Or if you don't have time to do that, we will attach that survey link into the follow-up email for you to have another opportunity. The survey is very important to our center and to our funders. It helps ensure that these events are beneficial to those who attend. Your participation, of course, is voluntary, but we would really appreciate you taking a few minutes to help us by completing this short survey. You can skip any questions you don't feel like answering, and all of your responses are confidential and cannot be linked to you in any way. Please reach out to myself or Ella or Abby or anyone here at our center if you have any questions about these surveys. Again, I think we've all become Zoom experts, but you are currently muted at this time. You can use the chat box feature to make comments or if you have questions. And then at the end of the presentation, you can unmute and maybe ask a question directly to Dr. Garcia instead of using the chat feature. And I know that we're gathered here virtually today, but we want to take time to acknowledge the land and pay respect to the indigenous nations whose homelands were forcibly taken and inhabited. Please take a moment to read this land acknowledgement, which was created by members of our team here, Ella Driscoll and Healy Driscoll and Sean Bear. Thank you. Well, without further ado, it's my pleasure to introduce Avis Garcia. She's an enrolled member of the Northern Arapaho Nation and affiliated with the Eastern Shoshone Tribe of Wyoming. She's got 2 decades of experience working in the mental health and substance use disorder field. We are really happy to have her here and part of our consultant team and part of our faculty and staff here through our center. So we're always appreciative of her contributions and really happy to be working with her on the projects like ESAS and other projects current and future. So I'm going to turn the floor over to Dr. Garcia. It's great to have you here with us today, and we look forward to your lecture. So thank you very much. We'll just give Dr. Garcia a couple of minutes to get her screen up, and then we'll get started.
Okay. Is about professional readiness, our attitudes and values. And this is an overview of what we'll be covering today. It will be clarification of values.
Oh, Dr. Garcia?
Yeah.
We're not seeing it.
We're not seeing your slides.
You're not?
If you go onto Zoom and you click the green button that says share screen. Okay,
now I'm gonna have to.
You see this is we're showing professional readiness in progress. This is perfect.
I don't know why it did that. I have it all set up. Okay.
It happens to me all the time.
I'm gonna hit share, and sorry guys, I'm just blabbing away and nobody's able to follow along.
There it is.
We're starting all. Here we go. Can you guys see now?
Yes.
That looks great.
Okay. Get my face out of here. Move that out of the way. Okay, back to the professional readiness, attitudes, and values. And I appreciate all of you taking time out of your busy schedules to join us today and spend some time preparing for the exam for those of you that are planning to take the exam. Okay, there we go. Here's the overview of today's presentation, which starts with the clarification of values, cultural considerations, building trust, steps to engaging American Indian and Alaska Native patients, supervision, stress and stress management and self-care. I also added some of the professional readiness topics under the 8 core areas of the exam for substance abuse counseling. And I didn't get to add that into this presentation overview, but we will be covering that today. As I look at these to add to them, I look at how does this directly tie into the exam. So I've done a little research and I'll be sharing that with you. Okay, to start off with a clarification of values. What are the standards of care that guide your work? So first of all, we need to look at ourselves to begin with. Where are my knowledge and skills best used? So what are your specialty areas? It's good to take time to know those, especially if you have a resume or a beta, you would, want to be able to highlight those skills and knowledge that you have. Am I getting the support I need to help the people we serve? So we're looking at who you are providing services to. So your values need to be in line with their needs. And do my individual practice standards and values conflict with the organization's expectations? So what our values are, what we live by, what guides us, and specific to this presentation is our values to our work and our ethics as we provide services to those in this profession. And most agencies have a mission statement that should summarize the agency's core values and oftentimes are directed by certification standards. They might say you have to list certain things like that you don't discriminate. So each place is different. Clarification of values. Standards may be set by the organization, and that's often the case, so it's real important to know those. Sometimes we have people coming in to review our certification, and they want to know if your staff actually knows what their mission statement is and what their values are and the services that are provided. We may ask ourselves, what is our overall agency mission and goals? Again, these need to be up in writing somewhere around your agency. Whose needs are being met, ours or the patient's? How can we improve upon our services to meet the patient's needs? So all patients present to us with a whole variety of needs, be it age, race, level of substance abuse issue, maybe some mental health concerns. So we need to know what all is covered there and how do our values tie in with that. The clarification of values, these are standards and can be set by our profession. This one is an example from the Code of Ethics for the National Association of Social Workers that states the profession articulates its best values, ethical principles, and ethical standards to guide social workers' conduct. Being a counselor in the counseling profession, I decided to throw this tidbit in there. In the counseling, ethics underpin the nature and course of actions taken by the counselor. Ethics, including ethical codes and principles, aim to balance the power and ensure that the counselor operates for the good of the client and not for the self. The primarily counselor's duty is to care for the clients. And the ACA has the ACA Code of Ethics here. I can attach this as an attachment to be sent out when the slides go out. So those of you who don't have a copy of the ethics, that's the book there. And just all of the work that we do, we have to be mindful of the ethics in our profession and that we follow those. More clarification of values, it is a commitment to patients, promoting the well-being of the patients. In general, patients' interests are primary, so they always come first. Self-determination, respect and promote the right of patients to make decisions for their own lives. Cultural competence and social diversity seeks to understand the nature of social diversity, oppression with respect to race, ethnicity, national origin, color, sex, sexual orientation, gender identity, or expression, age, marital status, political belief, religion, immigration status, and mental or physical disability. So there's a lot that we have to be considerate of in providing services in this profession. To define culture, the word culture describes the integrated pattern of human behaviors that includes thoughts, communications, actions, customs, beliefs, values, and institutions of racial, ethnic, religious, or social group. The social work standards for cultural competence. This is in the social work practice. Some cultural considerations, Native specific cultural risk factors. So for those of us that might provide services on the reservation to individuals in that community, and living in that community can be a little challenging. So trust is a huge issue because these people know you, and they know you know them and their family in the community. So they may be somewhat hesitant to reveal too much information about themselves because of that. And that there's a lack of social services, limited access to comprehensive health care, circular migration, unresolved traumas, historical or otherwise. An example would be the urban relocation programs, the boarding schools, the history of abuse, sexual or otherwise. And you all know the current situation that we're all concerned about today. And so that's kind of been weighing on me a little heavy lately. Racism, homophobia, transphobia, and biphobia. So there's a lot to be taking into consideration when you're providing services that are specific to Native Americans. Not only that, not only is there a lack, most Native Americans don't utilize the services at all. And the number slightly increases as the years go. Don't have to go, they're probably not going to. What comes to mind when you think of cultural competency? If you want to drop something in the chat box, that would be good. But when you think of cultural competency, I can't help but think of being able to relate to the specific population that you're working with, and Native Americans especially are often on the receiving end of the services, and when we're not feeling understood, that means there's an issue there with the person who most usually is not Native and doesn't fully understand the culture there. So another way to view this concept would be cultural humility, sorry, mixing my words up, incorporates a lifelong commitment to self-evaluation and critique. So this isn't something you just do one time and you got it. It's an ongoing process, as is your level of professionalism, is you're always looking to improve and enhance the skills that you have by continuing your education by taking classes such as this today, and redressing the power imbalance in the physician and patient dynamic, and to develop mutually beneficial and non-paternalistic partnerships with communities on behalf of individuals. Some key distinctions from cultural competency: acknowledges that we can never become truly competent in another's culture, requires simultaneous process of ongoing self-reflection and commitment to lifelong learning, works to redress power imbalances and develop mutually beneficial relationships with communities and individuals. Some cultural considerations: there are approximately 573 federally recognized tribes in the lower 48 states, and the Alaskan Native community has 231 tribal communities, which is a lot. Building trust, the big one, cornerstone for all communities we work with. We are to be non-judgmental. There is no right or wrong, and setting aside whatever biases you might have. And to be strengths-based, identifying behaviors that support healthy lifestyle, such as scheduling appointments. I always let them know that, hey, you made a good decision for yourself today by choosing to come here. Just making them feel really good about themselves and noticing those things that they do really well. Authenticity, personal connection helps build the therapeutic relationship. It's important to take time to establish a connection before work can be done with specific patients, and introductions are always important. Don't make any assumptions regarding sexual behavior or ageism. Make no assumptions regarding sexual orientation, such as straight versus gay identified. Engagement, it is customary in Native culture to provide something. And so if you want to provide a nutritious snack, fresh fruits, granola bars, anything that's healthy, and being mindful of the high rates of diabetes that affects our population across the country. And this can be as simple as offering a glass of water and meeting at a place of their choice, creating ease for the patient. Some people want to go outside, another town if possible, or transportation. Are there any after hours? Some people actually don't mind coming in on the weekends and after hours. So I've always tried to be flexible whenever providing services to be able to meet those needs of those individuals who would feel like they could be more trusting if they could come at a time when it's not so busy. And if it's possible, rearrange the furniture to remove any barriers to open communication. And a lot of places I've gone might have tables and everybody sits around the tables, but I prefer a large open circle, which is real common to our Native culture. Almost every ceremony we have is in a big circle, and most of the time we're sitting on the ground. So being able to provide that cultural context is another way to build trust. Affirming their Native culture, heritage, asking about their tribal nation or community. I know on my reservation where I come from, there are two main tribes there, which are the Arapaho and the Shoshone, but we have several that have moved in, married in, and come to our area. So it's always good to get to know them and make them feel welcome. Utilizing support and family connections. Oftentimes back home when we do the sweat lodge, this is the biggest family connection we can make there. I really encourage the participants to bring their families, and it's really good to see them come as a family with their children and participate in it's therapy, but they just see it as coming to do something we traditionally do, and being able to do that as a family. Assessing cultural knowledge and spiritual practices. So it's often good to do a cultural assessment. Those people that are on the reservation are probably your most traditional population versus those that are off the reservation and have been for many years. It could be that they're more assimilated into mainstream society and need reconnected to tribal practices. And also providing some incentives. Literature speaks to the patient and provider relationship regarding incentives. Is the patient seeking services only for incentives, or is the patient personally motivated? As long as the patient is returning for services, you have a golden opportunity to engage and build trust. So if that person keeps coming back, that's a good sign. Continued on building trust. Service providers work from a positive service delivery model. This is a strengths-based approach. It is collaborative, identify and exemplify strengths as a way to empower. Convey authentic interest using mindfulness, acknowledge and provide support for positive steps already made, returning for a follow-up appointment. People in care live longer and do better than those who are not in care. And advocacy on the front line. So some of these people are often, not only are they dealing with substance abuse, but in order to survive, they need to go and apply for certain benefits in the community. So Sometimes they want you to sign a form for them, or can you write a letter for them, or, you know, can you give them a reference letter for work? So I often have some very simple reference letters that I can fill out really quickly, because I really encourage them to seek and obtain employment, because research shows that those that are actually working tend to do a lot better in their recovery process. Building trust may require us to challenge systems. Whose needs are being met? For example, is the office located in the area where the community frequently visits, or is it an infrequent area? So you want to look at what's going to be most convenient for them. Complex organizational processes, barriers, steps, intake forms, and diverse to reflect the diverse patients, including the transgendered patients, and the implementation of programs where providers do not reflect the community served. Building trust, some other barriers to solutions, service providers, personal bias. So it's real important to take a good look at yourself and how you view yourself as a professional in providing services in this community. There's also oftentimes limited referral resources. So we need to be mindful of that as well. Sometimes they need services that are going to require getting them transportation sometimes to get to maybe some educational programming, and also that there is a lack of funding for a lot of services. So those are often limited, and some unrealistic timeframes in others. Confidentiality, building trust. Some of the issues of drug use, sex, sexual identities, gender identities, and sexual behaviors may be highly stigmatized. In Native communities, it is critical we maintain the highest level of confidentiality if we are serious about improving the quality of life. Okay. Native people may have a personal family experience with breaches of confidentiality. So a lot of times our family may go somewhere and start telling people things that they probably shouldn't. And I've had this happen, and I've even had to call in some staff to let them know that sometimes to check and make sure that they weren't the ones who leaked any information. And oftentimes it could be a family member that says they took them, or sometimes the patients forget and they will tell themselves. So it's always important to remind them, especially when you're running groups, that everyone's confidential is very important. Breach of confidentiality is a disclosure to a third party without consent or court order of private information that the physician has learned within the patient-physician relationship. The disclosure can be oral or written by phone, fax, electronically, or for example, email or health information networks. Trust impacts the quality of care. So in order to have high quality care, there needs to be trust. So we have to look at cost reductions. Most of these people are struggling just to get by. Make sure they get a complete health assessment, not just address the substance abuse stuff. Maybe it's time to go get a physical and see if they need to take any action to address health issues they might be facing and weren't aware of. And reduce patient referrals. So if you can provide most of what they need at your program, that would be helpful. Sometimes I invite those agencies in so that they can get connected that way. One of the biggest mistakes we make is assuming that other people think the way we think. And that's not always the case. And when I was talking about the professional readiness exam, I decided to do a little research to show you exactly where professional readiness pops up. And it's actually in every domain of the assessment. So the first one is the clinical evaluation, which had effective verbal, nonverbal communication, discuss with the client rationale, purpose, procedures associated with all of the services that they will be providing. So a lot of times we are providing patient education so that they understand what's going to be involved in their commitment to completing their treatment program. Assess the client's current situation, including signs and symptoms of intoxication and withdrawal. Know your policies and procedures, how to handle those situations. Should someone come in intoxicated or under the influence of some other substance? Administer the appropriate screening and assessment instruments specific to their age, developmental level. So where I work, we have the Addiction Severity Index, and we also have one that's for adolescents and adults. So the adolescent one is usually a lot longer because it tends to get into their family life, their education, and looking at the culture. And I've also shared the AccuCare with the ASI has a cultural assessment in there for Native Americans. So it lets you look at, do they eat traditional foods? Do they speak the language? Do they participate in ceremonies? Do they do craft work? All those things so that you're aware of. And oftentimes it's a way to find out if they don't do any of that. So you can be able to help them with that, because it's been my experience that a lot of them are very open to learning and wanting more information on cultural aspects of their treatment. Some clinical evaluation exam questions. Obtain their relevant history and related information from the client and other pertinent sources to establish eligibility and appropriateness. You need to know, who sent them. Sometimes it's the Department of Family Services that sent them. So we have to have releases of information so that we only give the information that they specify they want released. And again, we need to screen and assess them for physical, medical, and co-occurring disorders that might require more assessment and referral. So sometimes they need to go get us, so help educating them about that process and knowing your referral resources within your community. Interpret the results of data in order to integrate all the available information, formulate diagnostic impressions, and determine the appropriate course of action, and a written summary of the results of the assessment to document and support the diagnostic impressions. So this would be your final report that lists all of this information on them. Domain 2 is the treatment planning. There's approximately 20 questions in this area. Discuss diagnostic assessment and recommendations with the client and others to initiate individualized treatment plan and incorporate their strengths, needs, abilities, and preferences. This is known as the SNAP. So that's a short acronym. And how I've addressed this in the past is I just have those 4 statements on one sheet of paper, and I let them write in there what their strengths are, what their needs are, their abilities, and their preferences, because this needs to be covered in their treatment plan and showing that you're meeting their specific needs. Formulate and prioritize mutually agreed upon problems, immediate and long-term goals, measurable objectives, treatment methods, assessment of findings, and purpose of facilitating the course of treatment. So whatever it is you're going to do, make sure you know why you're doing it. If somebody asks, why did you do this? You can say, I did this because. Use ongoing assessment and collaboration with the client to review and modify the treatment plan to address their needs. While they're in treatment, sometimes I have people ready waiting for residential, but I might have them in my intensive outpatient program, and they've been there for like over a month already, and they're already starting to improve. So I'm oftentimes looking at avoiding going to the residential treatment route. And then there's also those that tend to get kind of backslide while they're doing really good, and sometimes we need to back up a few steps. Domain 3 is referral. There's approximately 10 questions on the exam. Identify the needs which cannot be met in the current setting. So if we have to refer them out, match client needs with community resources, considering their abilities, gender, sexual orientation, developmental level, culture, ethnicity, age, health status to remove any barrier that would facilitate positive client outcomes. Identify referral needs, differentiating between client referral and direct counselor referral. Sometimes I just have them take a piece of paper and say, you know, these are the things that you need to go do this week, so that they have a list of what they're going to do so that we can follow up with them the next time they come in. Explain to the client the rationale for the referral. Make sure that they understand, you know, sometimes they might not even be open to what you're suggesting. So we can't force them to do anything they don't want to do. And continually evaluate the referral sources to determine if the outcome of the referral is going well. Domain 4 is service coordination, 10 questions. Identify and maintain information about current community resources. Know all your resources, it's good. Almost every community I've been in has a community resource list that has the names, phone numbers, and all of the services that are provided on one sheet that can be easily handed out to anyone that might need it. Communicate with those community resources concerning client information to meet the identified needs of the clients. For some people, we've actually set up payment arrangements with another agency if they need their evaluation for oftentimes the Department of Family Services programs. And advocate for the client in areas of identified needs to facilitate the continuity of care. So if you know somebody would probably use some help to get some vocational training, maybe, you know, oftentimes they're so close from where I'm at that I'd be willing to, you know, call them with them there, or even go along with them if the time permits. Domain 4, continued, evaluate the effectiveness of case management activities with collaboration with the client, team members, community resources to ensure that everything is going well. Consult with the client, family, and others to make sure appropriate changes to the treatment plan are made and that they're making progress on their treatment goals. Prepare accurate and concise screening, intake, and assessment documents. So get familiar with the formats. Domain 5 is counseling. Lots of questions here, 33. Again, this is all specific to professional readiness. Develop a therapeutic relationship with the clients, families, concerned others to facilitate self-exploration, disclosure, and problem solving. Educate the client regarding the structure, expectations, and limitations of the counseling process. How I've handled that is I had scheduled a weekly orientation. So I often just let them start the program, but I cover the orientation class so that they understand everything, what the expectations are, what the rules are, what they are expected to do. So that's always important. Utilize individual and group counseling strategies and modalities to match the interventions with the client's level of readiness. Continually evaluate their level of risk regarding personal safety and relapse potential to be able to respond to crisis situations if needed. Apply selected counseling strategies in order to enhance treatment effectiveness and facilitate their progress towards completing their objectives. Domain 5 continued, adapt counseling strategies to meet the client's needs, evaluate effective counseling strategies based on the client's progress, develop effective continuum of recovery, assist families and concerned others in understanding substance use disorders. Oftentimes the family just wants to drop them off or send them there so that we can fix them. And I try to encourage each person to bring at least one person into their program, and document counseling activity to record all relevant aspects of your treatment. So you know how the saying goes, you know, if it's not documented, it never happens. So it's very important to stay on top of those notes. Domain 6, client, family, and community education. There's 15 questions. Provide culturally relevant and informal education that raises the awareness of substance use prevention and recovery. Provide education on issues of cultural identity, ethnic, age, sexual orientations. provide education on health and high-risk behaviors and substance use, including sexually transmitted diseases, provide education on life skills, including but not limited to stress management, relaxation, assertiveness, and refusal skills. So those are all good topics to address. Provide education on the biological, medical, and physical aspects of substance use. I think that is really important because a lot of these people have never actually taken the time to think that what they're doing is actually causing damage to their body physically. Provide education on the emotional, cognitive, and behavioral aspects of substance abuse, understanding the psychological aspects of substance use, abuse, and addiction. Provide education on the sociological environment. Provide education on the continuum of care. Domain 7, documentation, 17 questions. Protect the client's rights to privacy and confidentiality according to best practices in preparation and handling of the records, especially regarding the communication of client information with third parties. I am really liking that we have technology now because I feel like that is really helping the clients to feel more safe, knowing that we don't have documents laying around that somebody might be able to pick up. Obtain written consent to release information. You do not give anything to anyone without a release of information. Oftentimes you get family, especially on the reservation, moms, girlfriends, you know, you name it, they're calling, trying to do their business. And I have to tell them, I can't even tell you they're here unless there is a release of information for them. We can't tell you nothing. So it's important to let them know so that they can control what gets sent to who. Document treatment and the continuing care plans are consistent with best practices and applicable administrative rules. Document their progress in regards to their treatment goals and objectives. This should be done on an ongoing basis. Prepare accurate and concise reports and records, including recommendations, case consults, legal reports, family sessions, anything that's related to their treatment programming. Document all relevant aspects of case management activities to assure continuity of care. And not too many agencies I know have case managers because of the cost. So oftentimes, it's often the counselors that get to pick some of it up, but I've been learning to get the peer specialists involved in assisting with that. And document process, progress, and outcome measurements. So we want to know how many actually successfully complete their programming. And finally, we have domain 8, the professional and ethical responsibilities, 21 questions. Adhere to established professional codes of ethics. So know your code of ethics. Adhere to jurisdictionally specific rules and regulations according to best practices. Recognize individual differences of the counselor and the client by gaining knowledge about personality, culture, lifestyles, and so on. Being especially sensitive to the uniqueness of each individual. Continue your professional development through education, self-evaluation, clinical supervision, consultation to maintain competence and enhance professional effectiveness or scope of practice. There are some things that, you know, we can't be all and do all, so it's good to know who you can refer to. Advocate for populations affected by substance use. Apply current counseling and psychoactive substance use research literature to improve client care. So, you know, do ongoing research. Subscribe to professional organizations' email lists, because then you'll get stuff all the time. It's good to know all of that. Here are some specific steps to engaging Native patients. The first one is knowledge of Native-centric worldviews, understanding the roles of Western medicine, provide formal introductions, explain confidentiality, and understand circular migration. So knowledge of the Native-centric worldviews, many people do not conceptualize themselves as most important. Conceptualize the world based upon their membership to the community. Self may be secondary. So that is quite common across all Native culture, all Native tribes. We're there for our family, and we don't often look at ourselves as being the primary individual. We represent the unit and our community. Family can include others, not just our blood relatives. There can be in-laws, clans, distant relations, people in the community, and a lot of adopted members, quite common in my community. Understand the roles of Western medicine has its ties to historic and traumatic experiences. I often say most of it wasn't made for us. So it's finding our way and relying on our own ways to help ourselves, but not being closed off to the specific methods that do apply to treatment. Medical models can also be tied to other non-Native experiences. For example, reservation acts, exploitation of natural resources and government, and relocation acts. Providing formal introductions. Native people are accustomed to explaining their membership within a given community. A lot of times they'll tell you all about where they're from before they even tell you their name. Where I come from, our identity is a lot of times I've come across people that don't have names, and if we help them to get one, it really helps them a lot. Professionalism discourages personal interaction. Provide formal introductions. Handshaking is necessary. Small talk is a great way to gather information about the patient. Explaining confidentiality. Again, we got to remember the release of information is very important, especially in the Native community. People can be highly distrustful of anyone, so we need to reassure them that we are there to protect their confidentiality. And might be helpful to explain the process: double locked, limited access, password protected, encrypted, whatever your agency uses to protect confidentiality within its electronic health record systems. Explain who and who does not have access. Explain reasons why you would need to give information. So a lot of times your professional disclosure statement covers that last bullet there. It should cover all of that. Understanding circular migration. Native people travel daily, weekly, monthly from reservation rural communities to urban areas for work, education, medical care, and romance, of course, shopping and substance use. Urban dwelling Native people may live in urban areas and return home to the reservation or family communities for events and ceremonies. I have a cousin in Denver, so I just now saw he's on his way home. Okay, steps to engaging patients. Number 5, understanding circular migration continued. Circular migration can be a challenge to treatment plan adherence. As a result, a Native person might be labeled as a resistant, non-compliant, hard to reach, or unmotivated. So if you know they're going to be leaving, it might be good to help them identify resources that they can access when they get to wherever it is they're going. And sometimes I feel like they might be using it to get out, but it's good to hear when they actually make that connection on that end, because I'll ask them, can you let us know where where you're going, or let me know so we can document where they've gone. Supervision, administrative, evaluative, and clinical consultation with your supervisor can be a component of decision making. Oftentimes we encounter some situations where we're unsure of, so it's good to make sure you address that in supervision. And it might not always be available. And again, it might not always be helpful, but it is your ethical obligation to seek clinical supervision and not work under case evaluation only. So make sure you have someone that you're checking in with for certain issues that you have to address. I think my most recent case involved some cultural consultation of the person having these visions and experiences, which thankfully is a Native counselor that I've been working with, and she was able to pick up on that right away of somebody else got a hold of this. They would just be thinking this person was like having some kind of psychotic breakdown or something, when that was not the case. It was a specific cultural situation. Supervision. 3 goals of an effective supervisor is to assure the delivery of quality treatment and services, creates a positive work environment, and helps to develop staff skills. I would say my first year as an unlicensed counselor 19 years ago was probably one of the most important experiences in my life. I got to see people who had years of experience, who were my supervisors at the time, really support me and in expanding my ability to help other people. So under their supervision, they were able to provide me with books. I was able to check in with them again of, this is how, this issue is going. I think I was encountering people that were self-harming themselves, and I was like, oh my gosh, I didn't learn anything about this while I was in my counseling program. But I had a really good supervisor who got me like 3 or 4 books to read and gave me a lot of her experience in handling that, which really put me at ease with that. Supervision. Effective supervisors set clear expectations that are understood, provide feedback with respect in a timely manner, teach or demonstrate needed skills, provide a supportive, respectful environment, leading by example. You are a role model to your agency if you are a supervisor. Facilitate meaning, purpose, manageability in the workplace, promote self-care, and models said concept with supervisee. So I always like to throw a little wellness into my supervision meetings, and I will ask them, what one thing are you going to do this week for your self-care? And it is good to set those clear expectations by having professional development plans from the get-go. What are your strengths? What are some areas you want to work on? What are you going to do to meet these, and to have regular meeting times to follow up on them? I look at it as a treatment plan for my counselors. Stress begins with a life situation that knocked you out of balance, and the work that we do in the substance abuse and mental health field with natives can be very stressful. So it is very important to balance all of that for your own well-being. When life situations are perceived and cognitively appraised as distressing, emotional reactions, fear, anger, insecurity develop, which can lead to physiological arousal such as illness and disease. So learning some ways for yourself to set that aside when you leave your job every day. How many people actually have a little ritual or routine that they practice to help with that? Biopsychosocial stress. Biological, it affects our brain, muscles, emotions, our nervous system, our cardiovascular system. It affects your whole entire body. So that's why when they say you need to do self-care, this is what you need to do. You can't help anybody if you're not taking care of yourself. Psychological, these are specific to thoughts and feelings. And sociological, the surrounding environment. Stress symptoms, skipping rest and food breaks, binge eating, increased overtime and no vacation, increased physical complaints, changed job performance. Maybe they're not doing as good of a job, or they're behind on some stuff. Self-medicating, sleep too much or not enough. Emotional changes can cause low self-esteem, depression, anger, many others. The list goes on. So it's good to be mindful of those things. And again, managing this is ongoing daily. It's not get yourself work really hard to the ground and then, oh, I'm going to do all these things. Find a way to do a little something for yourself every day. Burnout and emotional exhaustion, which professionals no longer has any positive feelings, sympathy, or respect for patients. Sometimes we just need a change of scenery and we need to move. I think when I went back for my PhD, I was actually in one of those kind of burnout phases of like, I need to do something different. And so I took the next step to going back to school later on in life. I was one of the non-traditional students, but I really enjoyed it. Adverse work stress reaction with psychological, physiological, and behavioral components often associate with stress, fatigue, frustration, apathy. So it's good to be mindful of these signs and to take care of yourself to prevent burnout. Here are some of the stages of burnout development. So in the beginning, it's the honeymoon phase. You're happy, satisfied with the job, just love your job. And then 2, fuel shortage, you start to get tired. Stage 3, chronic symptoms, physical effects. Crisis, actual illness can happen. And 5, you hit the wall. Physical and psychological problems can become severe enough to cause illness that is life-threatening. So we don't want to get to stage 5. We want to be able to balance it out when being aware of these things, of when you need to do something for yourself to prevent further burnout. Simply put, it's for sustained, unmanageable, painful stress. Your response is your responsibility. Get help, set limits, manage those symptoms, explore new interests, new areas, new challenges. So advocate for yourself. I need some time off. I need to take a break. Finding ways to incorporate self-care into your day-to-day routine. Some help for the helpers. The greatest gift you can afford your patients, your colleagues, and your own family is the practice of self-care. We often work with our patients on taking care of themselves. Therefore, practicing what we promote takes even more significance. So I've often been asked a lot of questions of, well, what do you do? What do you do for yourself? And one of my biggest stress relievers of all time is getting a good workout in. I like to go to the gym. Work stays at work, leave it there. Don't take it home. It's good to separate yourself from it at the end of the day. Consider accessing EAP services. This can give you access to little or no cost confidentiality. Therapy services. I myself go from time to time just to check in. Stress management, humor. Watch some funny movies, watch some funny videos. I've been watching a lot of TikTok lately, thanks to my youngest daughter. Meditation, ceremonies, best thing we could do, traditional ceremonies. I like to go to sweat lodge. That is my thing. Prayer, spirituality, volunteer, relaxation techniques, and exercise. Make it fun. For example, Fitbit goals. So if you keep track of your steps every day using your Fitbit, those are good. And we are reaching the end of our presentation. And that is it for now. Do we have any questions?
I think it's very
Any
important
questions, anybody?
Can you hear me? Can you hear me?
Yes, I can hear you.
We can hear you.
Yeah.
Okay. I think it's very important to be, like self-aware of your surroundings and self-aware of self-care, and just looking at some of the symptoms that either too much sleep or not enough sleep, and just being fatigued, and always identifying with yourself every day. And then also with your family, if you're carrying on too much, then try to send it off onto another person in your family if your family needs help. And then even at work, and just identifying what you're going through and just some of the symptoms that you posted.
Mm-hmm. Thank you.
We open the floor up if you want to unmute yourself. Laura, I appreciate your question for Avis. We have some time. We can open the floor. Lee is asking, how do you deal with the stigma in the tribal community?
the stigma of substance abuse treatment or mental health counseling, or both? Okay.
Waiting to see-
I guess
Oh,
both.
here's Lee. Okay,
Yeah.
thank you.
Like definitely both would be helpful. I know it's like hard to try, but I guess more on like dealing with like tribal governments. Like, how do you get tribal governments to like kind of loosen up the stigmas that they've like learned over time?
I think it depends on your community, and the tribal health departments should be one of your biggest supporters in your treatment programming, be it mental health and or substance abuse. Again, looking at those hours that we could utilize that are after hours, or who wants to come in and do a little work on the weekend because someone is upstanding in your community and they don't want people to know that they need help, but they have to get it. So finding ways to work around that, but also getting the tribal health department and collaborative programming agencies in your tribal community. And I'm just speaking where I've come from. I can't speak for other people. And having that network of their understanding, and oftentimes every year, or at least 2 or 3, we share all of that information, and getting people who've actually done really well in your treatment program. My peer specialists are perfect examples. They can share with the community, hey, I was in the park just like these people are that we're trying to help now, and I finally got the help that I needed. And being able to share other success stories, I find it to be empowering and motivating to others to reach out. And really, like our tribal one of the recovery programs, actually, when we'll advertise events that it's not just for those in recovery, like anybody can come if we're having a sweat that weekend. And we do women specific sweats, and maybe we're doing beading or whatever, but you're not in our treatment program. We try to find ways to incorporate the entire community so that they're aware of what services are offered, and that when they need help, they can come to you. Using technology used to be added to the increased usage of people wanting to ask questions. And I just completed a training not too long ago of using texting, because I used to have an issue with one of my counselors who had everybody's phone number, and she'd have all this information because they were texting all of this to her, only to realize that if we keep the texting specific to their treatment programming, that they're more willing to give some information to you and share with you what's going on that way. So even the use of social media, we're using the Facebook pages more to get the information out there for those that might be interested, and just letting them be aware of the trainings like what we're doing here today to increase the awareness of these services that are available that many are hesitant to use because they see themselves as, facing that stigma. And so I talk about it a lot very openly with the community when I'm home, and even when I'm not there, because that's the way we're going to break down that barrier, is by people into the profession.
Awesome. Thank you so much.
This is Laura again. Here at our
Mhm.
community, I'm from the Blackfeet Nation, and we work in a whole group of prevention here at Honor Your Life is where I work. And what we do is really identify what's happening in our community, and then so we try to do prevention activities as far as mental health, suicide. We put up a teepee a couple weeks ago because it was suicide prevention along with mental health prevention. So they were able to tie like names of the suicides that we had on the reservation, and we put the colors representing green mental health, turquoise representing suicide prevention. And then now we're the month of June. This is a very sensitive part with my program. We're making LGBTQ awareness. So we're going to do like a Color Me Rad run and inviting the whole community, but putting stuff out there that mental health, you know, that we deal with in our community. And it's under like our Blackfeet Tribal Health Program is what we work under. Thank you.
That is awesome. That's exactly what we're doing back home too, is finding opportunities like that to have events that brings the community together. That's awesome.
Yeah, there's some good comments coming in too.
We used to do, we just got, because of COVID, everybody was just like, had to stay home and stay inside. And last year we're close to Glacier National Park. So the park that enters our reservation, East End, they closed that down to keep the COVID out. And that really helped. But now that we're opening up slowly, we also are planning like on every other week they were doing street dances and inviting the whole community. So we're kind of working with that. I think we got the go ahead to do it, but it's just letting people come out and be able to congregate, but kind of keep your social distancing also. So just doing that for the community is going to be fun.
Cool. That is cool.
Other questions or comments? We've got a little bit of time left. I've seen some nice comments come through on the chat box too. So appreciate everyone's participation and interest.
I think it's important to have those one-on-one conversations, right? When you're out doing like health and wellness fairs and reducing the stigma in person, right? One-on-one, where you might get somebody, you know, passing your booth or something like that, and they'll say, "Oh, I don't need that," or you know, they'll stay there looking at you, and so maybe reaching out to them and saying, "Hey, look, come on over and see what we have, and you know, here's some information." And then sometimes too, just understanding that not everybody's at the right moment in their time to talk about, right, like mental health or addiction too. So maybe offering like follow-up appointments and things like that. You know, come by the office, I can talk to you then. Just being welcoming. I you know, I was pondering, you know, this idea of, you know, what would I tell somebody if they told me they didn't believe in therapy, right? And like, how would I convince them that therapy works? And I just try to think of like the medical model, right? And maybe how we function as humans, right? And like just relating to that person and saying we have thoughts, we have emotions. And if you at least on a foundational level believe that, then those thoughts and emotions can impact how you function on a daily basis, right? And if you have trauma, or you have some kind of either substance use issue or something that's affecting those thoughts and emotions, then therapy could work. And so I think some of those ways of breaking down a lot of the systemic knowledge for individuals that would just come up to you and just challenge basically your whole beliefs, right? Why does therapy work?
I always share with them that there are risks involved. And over the years of my working in this field, I've come to the conclusion that a lot of these theories are textbook and made by Western European experts, professionals, and not by Native American professionals, except for Eduardo Duran, who, even though he's not specifically Native, he's that Latino background, and all of his years of working with specifically Natives, he has some interesting viewpoints. And I have come to my own personal conclusion of therapy is not for us. That's why we're like, why do we want to go? Because some person says I have to go. And when I can present the treatment programming as this whole menu of topics that is just strictly educational. I'm not here to analyze. I'm not here to diagnose or label. We're just here to help you, whatever the court says you need to do, because 99% of the substance abuse people, they don't come on their own. They don't just come in the door and say, hey, I want to get help. They're usually sent by a third party. And I let them know from my personal experience, I never really went to therapy all my life. I saw a need to want to help because I saw my own family members be in need of help and not want it, but realizing how I was able to help myself through cultural, spiritual practices and ceremonies is all that I ever did. And I still continue to do that. Should I be struggling or having a hard time? Yeah, I'm going to go back to that because that's what I know works. And all of our Native people, we have our ways. And so, not that I'm saying everybody needs to go be traditional, but if you can have that connection, you'll find what works for you. And sometimes they just need to meet these specific requirements. And sometimes people might have some depression and some anxiety. And there is research that shows, so if you have some research to show them that shows it is helpful, it could be helpful to let them know that sometimes learning coping skills, like when you're getting depressed, how are we going to cope with that? When you have anxiety, how are we going to cope with that? And medication sometimes is just like to balance out those chemicals so that you're feeling better. And that's a choice they have to make. And I'm not there to tell somebody that they need to, have to, should, because like I said, wasn't made for us. So we got to find what we know has worked for us. Traditionally, I gone to my grandparents. If I was having a problem, I went to them and would tell them what was going on. I didn't go to counseling. And even to this day, I go every now and then, but it's just to have that objective opinion. And I'll tell them, I'm just here to use you as a sounding board and, get some stuff out. It gives you a whole different perspective on things. And like I said, it's not, they will challenge you. So if you can find your way of dealing with that, that's something, one of your tools that goes in your toolbox, because you're going to encounter them all the time.
I definitely like that idea of setting up like classes or just things that are informational and, putting it in general, like these are things for everyday life, not just for specific. Thank you.
Mm-hmm. You're welcome. Anyone else? Questions? Ideas? Anybody else have to deal with someone challenging the effectiveness of therapy or going to treatment?
I think the other thing that stood out for me is getting a family member involved. I like that idea. I always try to say, we'll do at least one family session, maybe after 3 individual sessions. It's a good gauge to see how your client is responding to the treatment, and maybe to get some feedback and support. And really, that's how I try to keep those sessions open. And then later on, it allows them at least a format to kind of how to self-regulate at home, or if they're dealing with a craving or any anger or anything like that in the relationship, they at least have some kind of to help prevent relapse in the future.
Yeah, that is really good. like I was sharing with you, to me, the sweat lodge seemed to be the most family connecting activity we could do back home. So we continue to do it. And also having maybe once a month of family activity, of course, natives, if you offer a meal, you're going to get that family to show up. So sometimes it's just stew and fried bread, and we're able to get them to come in with someone just, for that, but able to share with them, find some topic to present, and maybe even showing them what their role could be in helping that person. Because I myself, before I got into the profession, came here because my mother was an alcoholic when I grew up, and I wanted to help other people. And it was being able to share with them that by, learning about how treatment works and how it affects the family, like all the dysfunctional family roles, and being able to identify that, I by no means am I perfect from what I've learned, but being aware of those situations and how we can address each of those roles within the family, and them learning that it's not you just drop someone off and fix them. You have to be involved, and sometimes that takes that whole family, because we got so used to living our life by grandpa's drinking all the time. We'll see ourselves fall into those dysfunctional roles. But how can we help that person get back on track and remind them that we're there to support, we're there to help. So it's being able to educate the family to know that not just does that person need help, but we need to help too. We need to find our way to improve our family communication and not be walking on eggshells.
When it comes to the
Yes,
community, go ahead.
Yes, I just wanted to say that I think one of the most important things, especially as I'm a recovery coach, and I think one of the most important things is to let my recoveries know, I give them information, I give them choices, because it's really up to them whether they want to get help or not.
Mm-hmm.
And I think it's just very important that you give them choices, and then you listen to them, you talk to them, and you listen to them, because most of the time they may have a problem, but most of the time when they're talking, they've already said the solution to their problem. So you have to teach them how to also listen to themselves, because most addicts, they already know what the problem is, but they have to listen to themselves. You understand what I'm saying?
Yeah.
And I think it's just very important that we don't push things on them, that we let them know, hey, I'm here for you. I'll listen to you, I'll be here for you, but it's your choice. And if you choose to do this, that, and the other, hey, let's do it. Okay.
Mm-hmm.
I'm not going to force you. You do you. That's what I want you to do. I want you to do you. And I'm here to help you. So I don't know if that made any sense, but
no, you made perfect sense. And you have a life experience that gave you those tools to be able to help in that way. And it sounds like a very effective strategy that you're using there to allow them to have that choice. And that's why I've seen 2 programs on my reservation, and we're 2 tribes, and we're in different parts of the reservation, and one is really strict and has all these rules, and people just drop out like flies there. I hate to criticize one of my, but then I see this other one on the other end that is more open to where they have a choice. There's no certain specific times they have to be there, that we have created a menu of classes that meets their need. Like you said, the choice, So it's almost like a menu for the month of like, oh, this day I'm going to go do that, and they don't have to be there the full time. We run 3-hour groups. If they want to stay for 3 hours, they can stay for 3 hours. If they want to stay for 1, they get 1. We just track their hours for them. So once they hit that mark for meeting their level of completion for whatever level of care they're in at that time, that is how we work that. So it is a pick and choose. If somebody is being forced, a lot of times they're not going to want to be a part of. So if they know there's some goal that they have to meet, usually for probation or parole, and that they have control of that, that's your person-centered working with that person. That lets them sit in the driver's seat and decide which way they're going to go and how they're going to get there. I like that.
And I have to admit that it wasn't until I got into White Bison that I didn't realize that I could go it in a native way, native teachings. I didn't know that I could do that. Okay. So when I got into White Bison, it taught me another way of dealing with my recovery, not only through, Narcotics Anonymous, but also through native teachings. And when it comes to native people, especially, I'm going to speak about my territory, they didn't know that there was a difference. So I try and tell them and show them and give them the opportunities that we can do this our way, and it's a good way, it's a good way. So thank you.
At your community sweat lodges, is there, like, I worked for an agency that had community sweat lodges for folks that were in recovery, but there is the barrier of having to be fully sober in order to participate. Is that something that when you have the sweat lodges, is that a rule that has to be followed?
Yes, it is. It is with all of the treatment programming, and I've never had anyone show up to a sweat lodge under the influence. So is that been an issue for you in your area?
It's not like if they're showing up to the sweat under the influence, but let's say they had 3 weeks sober, and then maybe a week before the sweat, they ended up using substances, then
That's
they
fine.
wouldn't.
Yeah.
Then they wouldn't be allowed.
No, I would not do that. I wouldn't care if they used a day before they came in. It's just when they come in at that moment that they, have not been using that day.
Nice. So it's more low barrier for the day of.
Yeah, no, you don't want, to me, that sounds like a, what do they call it? I'm thinking of in drug court terms. It's not to be punishment, they're trying, and hey, it's not easy for people to get in recovery. And some people, it takes several times. I have a very dear friend who it took her 6 times of residential treatment to finally get herself sober for as many years as she's been sober. And seeing people struggle with it all the years that I've been in this field, it's not something that's easy to do. So we have to meet them where they're at and not punish them for they tied one on the week before the sweat lodge, or they use some other substance. It's they realize in their own selves that what they did wasn't right, and that's why they're showing up. They feel like that's that one thing that is going to help them, and that's their program. They get to create their program, and we're there to support it.
These are great questions. We've got time. We're approaching the bottom of the hour, and I wanted to just put one more question out there from. Was a good question, I thought, from Judith P. it says, any advice for those professionals who have no Native background to build trust with Native communities?
Ah. Any advice to build trust with Native communities? It depends on what community you're in, but I would suggest you get to know your community very well. Some communities do a really good job of orienting people into the community on a professional level. I'm often asked to be the one in my tribal community for both tribes when they encounter those situations. And the Wyoming Indian High School, where I come from, does this really awesome orientation. And if I can refer people to it, I do. They spend about 2 to 3 days of just participating in nothing but cultural activities and events. And it's all provided by tribal people in the community. We talk about the history, we talk about the trauma, we talk about everything. So knowing what's going on in that community. Basketball is a big thing back home. So if you want to go to the COVID affected our gatherings, our powwows and our dances, but I'm very hopeful that those are going to come back. Those are the places you want to be. I know people tend to watch those that come into the community. So, find yourself someone that you can connect with and spend time with them, get to learn about their history and their culture and how things are in that community, and educating yourself by being here today. That's a good start for those that don't have that background. And those very brief tips that were in this presentation today, offering them a cup of coffee and some little snack. I run into clients all the time that's like, I didn't have time to eat, and some of them don't even have anything to eat, and so I'll be like glad to dig out whatever snacks I had in my desk and be like, here, let's get you a bag, and let them know where all the food places are, and just spending more time with the people in that community and asking people in that community if they would suggest anything that might be helpful to you.
Thank you so much. It was very helpful. Thank you.
You're welcome.
We have reached the bottom of the hour. I want to respect everyone's schedules, and I want to thank, of course, Avis Garcia for spending this time with us today, and all of you for taking the time out of your schedules to participate and listen and learn. And we're really happy to continue providing events like this, and can really appreciate all of your support as we start to think about getting back to normal lives.
New normal.
That's right, whatever that is. We're going to continue to provide virtual events. We were doing this prior to the pandemic, and the ESAS has been one that will continue. It'll remain unchanged. So that won't be affected by any return to other live events. But I want to thank everyone again. And if you haven't had a chance, please fill out that short survey for us. We'll broadcast again next month. And I didn't get a look at the topic for next month, but we will make sure we get that out on our listserv and make sure that everyone has a chance to attend and participate. So again, thank you. Until next time, stay safe, stay connected, and stay healthy, everybody. Thank you.